Hello, everybody. It's Adam from the Rural Health Workforce Transformation Hub. And if you're in Alaska, I've got really exciting news for you. Just yesterday, the Department of Health did a webinar explaining how it's going to be running its application process for Rural Health Transformation Program grants. They're going to be distributing $270 million in year one. And in this video, I'm going to tell you how you can start your application to get your hands on some of the funds. So let's jump into it. Before I get started, tell you a little bit about who I am and why you should listen to me. I'm Adam. I'm the president and founder of a company called Nurse Recruitment Experts. We've been about since 2019 providing healthcare workforce recruitment and retention services. We're not based in Alaska, but since 2022, we have worked with clients in Alaska. Our biggest client has probably been the Southeastern Alaskan Regional Health Consortium down in Sitka, who cover much of Southeast Alaska, a couple of hospitals, tribal health clinics as well. We've helped clients win about $1 million in grants like the Rural Health Transformation Program through our support. So we opened the Rural Health Transformation Hub in August this year to really double down on our track record in rural health and to disseminate a lot of the knowledge and resources that we built up over the past 6 years into rural healthcare facilities, because you really are the backbone of healthcare. In this video, permit me to go over what was covered in the presentation by the Department of Health, and I really hope that this will provide a different viewpoint, a bit more opinionated perhaps. You want to check their thing as their webinar and their presentation as the gospel truth, and take what I'm saying as opinion and advice from an external person who's trying to help you win the funds. Take it with a pinch of salt. So here's the timeline, and all pretty simple, but interesting thing was they have to make year one awards by October this year, October 2026, and spend that $227 million by October 2027. There will be other years, so if you're not successful in your application this year, do not worry. I'm going to come down to the letter of intent and talk you through that, because that's really the meat of this. That's how you can get started with your pathway to getting these funds. And you need to fill that out if you want to have a chance of getting money in first year. This is extremely important. This is your first step to officially putting yourself out there with a plan that you want funding for. So Department of Health has engaged the Alaska Community Foundation to help them administer awards and choose awardees. Here's a timeline that you need to be fixated on. So registration is open in 6 days from today on February the 17th and closes on the 11th of March. So you've only really got 3.5 weeks to put together your letter of interest, which, as I said, is mandatory if you want to access any of these grants. So in the letter of interest, they're requesting that organizations let them know what they want to fund and who they are, what the challenges are in the area, and how it meets some of the initiatives which the state laid out in its application to CMS. You'll see that there's 4 pathways here, and I'm going to briefly tell you about each. You don't really need to think about this too much. This is a statewide initiative that's going to be selected through targeted processes. There's not really an RFP set in stone to come out for this yet. And you can see here that it's in a dotted box, which means it's separate and it's to be decided. You should be focusing on are these 3. So the first 2, readiness and planning grant. It's not clear to me yet, at least, how much monetary value will come into these. Like, are you going to get 20 grand to do your planning for an early stage project, which you later apply for funding for a implementation level project, which is a ready to go project? Or if it'll be more, they give you support, which of course has a monetary value because they're getting paid. The Department of Health or Alaska Community Foundation is getting paid out of the grant pot. It's not entirely clear to me yet what that is, but I should say, if you're going for a letter of interest, I've been calling it a letter of intent, but never mind. At this stage, I would advise you to think very strongly is your project ready to be funded this year? Or could it be ready to be funded this year by April or May? If you go in for one of these grants, then these are the grants that you're applying for, and you're not going to be given one of these grants. But if you think that your project could feasibly be implemented, you have all your ducks lined up, you've got partners, and you know what problems you want to solve, you know what initiatives the state has, and you know what you want to do, I really strongly advise you that you state in your letter of interest that you are ready for an implementation grant and you want an implementation grant, and you're able to plan out a budget for that. But if you're not ready for that, then do be honest, and they have these two grants available for you too. As I said, not entirely clear how much money's there, but I do know that based on their tone, most of the money I think is going to be going to people that go in for this implementation grant with a plan that's ready to go. So you need to register on the Alaska Community Foundation's platform to apply for this. And all of these are pretty simple. A couple that might trip you up. So if you're a smaller consultant or you're a primary care doctor, you don't have a nonprofit entity, a corporation, or an LLC, you need to make one to apply for this. You need to be an entity because you need to have an employer identification number from the IRS to really sign up to this platform that Alaska Community Foundation have. So just a quick note there, if you're an individual and you have ideas, you need to make some kind of entity to apply and get funding from this. Now, if you don't know what this is a unique identifier number. It's a number that's given to you from this platform called sam.gov. This is the federal procurement platform where if you have your EIN, you have your entity information, and all your registration documents, financial statements, you can come on to sam.gov, check if your entity has a unique entity identifier at the moment. If it doesn't, then you can click Get Started and go through their process to achieve one of these. When I did it, it took about 10 days to get one. So I do strongly recommend you to jump on this quickly if you don't have a unique entity identifier. Come on to sam.gov, entity registration, click Get Started, and follow steps outlined here. Now, here is the meat of this. What do you put in your letter of interest? I'm going to give you a brief outline for it and probably expand on it in another video because we're just at the start of this journey, really. The platform hasn't opened, it opens in a week, so watch out for another video. However, I've got a few headline things to draw out to you. The first is the webinar that the Department of Health did yesterday had 2,000 attendees on it. So that's a lot of people. If you say like 25% of them are vendors, you've gone to 1,500 and say each organization had two people there. So that's still 750 applicants for this money. Now, the good news is the pot is pretty big. 272 million across 750 is, it's quite spread out, well spread out to each applicant. I'll let you do the mental math on that, but I think it's about like 350,000 each. So some are going to be applying for a lot more than that, and a million plus, those bigger health systems. And then if you're a smaller community-based organization, you're probably going to be going in for a lower amount. However, the money's there, and I encourage you to go for this. The crucial point of this is aligning a few things up. So coming back to my slides, whenever you go into it, I really recommend that you think about the problem or opportunity that you hope to address within your organization. We see a lot of organizations look at the money and think, how can we make something that gets the money? But that's not really the best way to think about it. I believe that money needs to come in and solve a problem in your community or in your organization that improves rural health outcomes, and that's what the state wants to fund. Of course, you can look at the grant pot and say, oh, money. But the next step should be thinking about, okay, how do we connect money and problems? Because with a glut of money, it might add extra work that you're not really benefiting from if you never needed the program in the first place. So think about what you want. What ongoing or recent work are you doing or have done that you want to expand? What is impactful but underfunded? Are there any new initiatives you want to put startup funding into? Quick note on this that construction costs are disallowed, but renovations are allowed. So converting a space so you can do telehealth within it, that's allowed, but building a new center for telehealth isn't. Interestingly, in the state's application, they said that private funders would be sought for some construction costs. So I wouldn't rule that out completely whenever you go for this letter of interest. You could just put a little asterisk and say, acknowledging that the state applications and private funders could be sought, we would be open to doing that. But it's not a core part of our application because construction isn't really allowed from the federal grant pot. What do you do next? Well, look at what the grant is asking for. So you know what you want, but you need to fit within the grant criteria to get funded. This is called being compliant. So whenever you're compliant to grant, the assessors have a list of boxes that they need to tick when they read your application. And if your application is requesting funding for categories that don't fit into those boxes, then you're not going to get your ticks. You need to answer, math questions on a math test. It can't be writing a history essay, for example. So what are they looking to fund? Well, they've laid out three main goals, and within those goals, there's 6 categories, okay? So whenever you're writing your response to the LOI, you need to be coming in with a program that fits neatly into one of these goal boxes and then the initiative box within the goal. So, for example, if you want to recruit more physicians into your area, say you want to relocate them from the lower 48 states, you would say that this initiative meets goal 3 to drive workforce technology innovations by strengthening our workforce with the addition of 1 or 2 more physicians. Or if you have an initiative to promote awareness of substance use disorders, you'd say that this initiative meets goal 1 to promote lifelong health by encouraging healthy communities through a substance use awareness and public health campaign. So don't go in making it all about you. You really need to present yourself as the Robin to the Batman of the program who's going to help it achieve its goals of improving rural health. So when it comes to your proposed approach, you can see that there's a box for that, and then there's a box for alignment to rural health transformation program initiatives. Now, if you're wondering where can you find those initiatives, you want to navigate to the state's application to CMS. So if I come in here, Alaska RHTP, and I navigate down, see that they've got a lot of information here for the exam stuff, and that's all well and good. You can come in, you see those 6 proposed initiatives, click on this box, and you'll get the full application. So 88 pages, you don't need to read them all, although I recommend you do, it's a good read. Come on down to page 20, and you'll see those proposed initiatives here. So going back to the start, when you think about what you want to fund within your organization, read this and see how, if any, categories here that could be fit into. And if it can't be fit into any of these categories, I recommend you have another think about what projects suggested by these categories could solve your problem. So you're kind of reversing it. But these categories take prime place. You need to propose something that fits into one of these initiatives and ideally echoes or rhymes with one of the potential uses of funds. You can see that it is potential, so I would kind of focus on this bit here first as guiding what you're going to propose. These are suggestions, but it would be great if whatever you're proposing can reference how it does one of these potential uses of funds. You could sort of highlight these as sub goals, so saying our idea, our program will build healthy habits for youth by XYZ, or it will provide tech assistance to support healthy beginnings by XYZ. On the webinar that the Department of Health ran, they told us that it would be 2,500 categories, more or less, per response. So that's about 350 to 400 words, and split across those 7 bullet points. So you're looking at almost 3,000 words. I do believe that this is a very important part of your application. It's not your official proposal or response to the RFP, but this is the first hurdle. You need to present yourself in an interesting and attractive way that meets the grant criteria in order to get over that hurdle and then be invited into the room where it happens, where people can make a full proposal for the implementation grant. Otherwise, you'll be here and then they will put you into the readiness or the planning grant category potentially, and you'll get a little bit of support across readiness planning, but you won't get funds to actually implement the project probably until the next year, which is October 2027 onward. So here's some ways you can stay informed. I would say that keep close to this page. By the way, applause to the team at the Department of Health for all this. It's really comprehensive and one of the best state approaches that I've seen for states managing this program. They're keeping everyone updated very well. If you're a little bit frazzled and unsure where to start, or you want to strengthen an already strong application, then by all means, you can reach out to me. You can visit our Rural Health Workforce Transformation Hub to get our articles and advisory on this, or you can book a call with my colleague, Dr. Michael Fitzmaurice. He will talk you through the program and tell you how we're supporting organizations in Alaska with their public health, workforce, and tech innovation initiatives. Our offer to you is free support in writing your grant proposal and coming up with a program. We don't charge you for any of that. And if you like us and you think that we can help, we're open to being included as a subcontractor partner in your proposal who will help you implement your public health, workforce, or tech innovation project to benefit your rural community. So somewhere around this video, you can click onto that or just search hub.nurserecruitmentx.com and you can book a call with Dr. Fitzmaurice. So thank you so much for watching. All the best with your application, and I'll probably see you in another video. Bye.